All right, so let me tell you how I think I win if I'm the CEO of Oracle on this. All right, so you come into healthcare, you have to change the game on Epic. It's almost like this game is played out. So the first thing is there has to be value in the data, and you have to figure out a way to unlock the data. You have to make Cerner clients so much better with their data than Epic clients. And by the way, I think this is doable. I don't think anybody's won the data and analytics and machine learning and AI side of this. And I think that's an area where Oracle can really help Cerner. Cerner had some challenge. I mean, I dealt with Cerner on the data side. I scratched my head a couple of times when I walked out of meetings like, these are some of the smartest people in the industry, but it didn't feel that way. I also think Oracle has some experience outside of healthcare that they can bring to healthcare. That's another aspect. They're touting their voice and experience technology. I think that's only a revenue play. So I think it's going to be a couple of years, but I think there is a play there in the experience side. If they can somehow break apart the pieces of Millennium and put them back together in a way that is 10, 15, 20% more effective for clinicians to interact with the EHR, and perhaps that uses voice in some way, shape, or form, that's going to address a major problem that healthcare faces right now, which is a staffing shortage. All right. So they plug themselves in as we can help you with the staffing shortage. We can help you to really win the race on this analytics without bringing in too many third parties. And oh, by the way, we can start to integrate your ERP with PeopleSoft and other things that others can't. And we can give you this complete system and obviously grow the cloud revenue. I think those are the winning strategies in healthcare.
I like that. The point being things like staff shortages and what are real problems in healthcare, that's where they focus their energy.